Welcome back. Well, if you're struggling with constant heartburn, you are not alone, and you're certainly not out of options. Health experts say that persistent GERD can actually impact your health, but with the right treatment, it can be resolved. Here with more details on all of that is Dr. Ken Schwartz from Middlesex Health. Dr. Schwartz, thanks so much for being here.
Thanks for having me.
And this is an important topic that actually does affect a lot of people, correct?
Yeah, millions and millions of Americans suffer with GERD or acid reflux disease, which is an interchangeable term.
Now, can you explain to us exactly what this is?
Sure. So, food and fluid after you drink is supposed to stay down in your stomach. If that mechanism that is meant to keep things down doesn't work, then it can freely come up into your chest, mouth, wherever, and that causes problems.
Okay, now you and I were talking on commercial break. Most people experience this every once in a while, depending on if they eat something, this or that, but the real problem is when it becomes persistent, correct?
Right. Now, we all know what heartburn feels like, or most of us know. If we eat too much or too much alcohol, too much tomatoes, you get heartburn. And every now and again, that's not really a problem. The problem is when it becomes a constant or near constant issue where it's happening over and over again, or it's worsening where the people who really know what it feels like know what it feels like to have bile or acid come up into their throat and mouth, wake them up at night. That's a bad problem, and that needs to be not ignored.
And so chronic, would you say if it's happening every day that you should go seek help?
It doesn't have to be every day. It can be a couple of times a week. Really, if it's impacting quality of life, that's a big deal. But also, without knowing what's going on the inside, you don't know how bad it's impacting your health generally.
Now, I feel like putting out there exactly how the process works when you go to a doctor about things like this, it kind of eases people's concerns about going to the doctor. So what does the process look like when someone comes in and thinks they have persistent acid reflux?
Well, generally, and we're very lucky in Connecticut to have really good doctors. We've got great gastroenterologists and surgeons like me that do this. And finding, a gastroenterologist or somebody who runs a GERD program, a surgeon that does that, it really entails getting down to the diagnosis. Do you have what you think you have? And if you do, how can we get to the root of it and treat it? And typically it's, what are your symptoms? And then usually you'll get an endoscopy, which is a scope with a gastroenterologist, to look down inside at the lining and make sure there's nothing bad, really bad going on, because acid reflux disease is a risk factor for esophageal cancer. And we want to push that down and stop that in its tracks.
Absolutely. And there are actually treatment options that are minimally invasive to ease people's pain when it comes to this.
Yeah, I mean, medication is really good and it works pretty well. But there's a certain time when medication stops working or it never worked particularly effectively. And then we start thinking about surgery, minimally invasive surgery. And that usually entails, fixing hiatal hernias where they kind of go hand in hand with reflux disease, and fixing the mechanism that is no longer functional.
Okay, so there are plenty of options, but the first step is to just come and see a great doctor like yourself.
Well, you don't sit on it.
Yeah. Action, early intervention is always key when it comes to things like
Every
this.
time.
Yep. All right, well, Dr. Schwartz, we really appreciate all your great advice.
Thank
if you would like to learn more, you can head to middlesexhealth.org or our website, WTNH.com. We'll be right back.